Okay, so in this video we're going to go through our lateral glides of the hip in terms of our accessory motions. So Glenn, how would we do our lateral glides?
A couple of ways. I'll show without the belt. I always use a belt, so I'll show with the belt after as well. What we're going to do, we're going to come up into this position. I like to start in flexion, so about 90 degrees. I'm blocking the femur with my chest, and then my hands are coming into the proximal part of the femur, and then from here I'm just going to glide laterally. So I'm making sure that I'm specific to the hip joint, and as we were saying before, depending on where they're getting their pain, you might want to try same thing in different ranges. Yeah, you might even wind them right up past 90, same thing again. But I'm controlling that movement with my body, gliding with my hands, blocking with my chest. Yeah?
Yeah.
Exactly the same principle with the belt. Just grab a stack towel, Chris, and I'll set him up with here. Always want to make sure you've got a towel in the thigh when you use the belt. And then I ask the client to position that for me.
Again, without the towel, essentially it's for pain, patient comfort basically, isn't it? Because it's very uncomfortable to use the belt without that. So it just means that when you do these glides, you're not going to get that the pain. If you're asking about pain, especially, it's going to be their symptoms rather than pain from the belt digging into the leg, basically.
So it's the same thing. Now my chest is blocking, but it's going to be the belt doing the glide rather than my hands. My left hand feeds into the belt and stabilises the pelvis, and then I'm just literally shifting my body weight back through my hips and creating that lateral glide.
So you've got your left hand inside that belt onto the ASIS.
I go inside, around the pelvis if I'm on the ASIS. And again, I find I just get more control, and I can actually generate a little bit more force using my body, And
then just you moving your hips backwards, which creates that glide.
Exactly. I mean, when we come on to treatments, there's lots you can do from here. You can glide and you can rotate, you can combine movements. It just frees you up for a lot more possibilities when it comes to treatment as well.
Perfect.